Welcome to your guide to breast reduction surgery. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. Many women seek breast reduction or reduction mammoplasty because they are having back and neck problems caused by the excessive weight of their breasts. A breast reduction can help relieve some of the pain or soreness in your back or some of the pressure from bra straps that usually come with large breasts. It is sometimes performed in conjunction with liposuction of the underarm and upper back area. Physically healthy women with ideal body weight and with realistic goals are good candidates for this surgery. Procedure: how will your breast reduction be performed? There are two main techniques that may be used, depending on the amount of correction desired. If your breasts are extremely large, the anchor or keyhole incision is often used. This technique uses incisions which roughly resemble an old-fashioned keyhole, circling around the areola, down the breast, and along the breast crease. The vertical incision technique is generally performed when a more moderate reduction or limited lift is necessary. This involves an incision that takes the shape of a lollipop with a circle around the areola and a straight incision down the center of the breast, ending at the crease beneath the breast. With each of these techniques, once the incisions have been made, excess breast tissue, skin, and fat are removed. The nipples are moved to their new higher locations, and the skin is tightened to give a new shape to your breasts. The incisions are closed using very fine stitches and then taped to help reduce scarring. You will also be fitted with a support bra to help you heal and make you feel more comfortable. Together we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Preparation: every woman has a unique perspective on what may be the best shape for her breast, and your goals will affect the way your breast reduction is performed. It is important to discuss your desires and listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. You also need to understand that the shape you have before surgery will partially determine the shape you have after surgery. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open. Provide all your medical history, drug allergies, list any previous surgeries or biopsies, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some tips that may help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your breast reduction and for 1 week after surgery. Drink lots of water in the days leading up to your breast reduction. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first 24 hours. Fill your prescriptions prior to surgery and place them within easy reach of where you will be resting. Place plenty of pillows and a bed wedge nearby so that you can keep your back elevated. Have several loose-fitting, button-down blouses ready to wear in your new breast size. You will also want to avoid raising your arms above shoulder level during the first few days after surgery. Recovery: you should expect some bruising, swelling, and pain for the first week or two. Stitches will come out or be absorbed on their own between a week and 10 days. Swelling may linger for as long as 1 to 2 months. Pain medication will be prescribed to control any discomfort. However, if you begin to have severe pain, contact us immediately. The recovery process is different for everyone, but within a day of your breast reduction, you should be up and walking around. For the first week or two, you should plan on being out of work and away from your usual activities. Over the next 2 to 3 weeks, your breast may be very sensitive, and strenuous physical activities should be limited. In particular, you should avoid jogging and bouncing activities for up to 6 weeks. You will need to wear a support bra for about 1 to 2 months. Following this period, you may gradually return to activities such as lifting, exercise, and sex. These precautions will help you avoid stress to your scars and allow time for your breast tissues to heal and recover. While there will be permanent scars, they should be well hidden when you're wearing clothing, even when you're wearing a swimsuit in most cases. The scars are usually small and become difficult to see as they heal over time. The appearance of your breast should improve over a period of several months. What are the risks of breast reduction surgery? This information is not intended to frighten you, but will help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Although reduction mammoplasty is a well-established surgical procedure, there are risks of complications. Just as in any operation, bleeding, infection, and scar formation can occur. Other complications may include asymmetry in size, skin loss, decreased or loss of nipple sensation, and inability to breastfeed. Breast reduction surgery does not normally interfere with pregnancy, but if you are planning to have a baby, your breast skin may stretch and offset the results of the reduction. All women should start routine mammogram screening by the age of 40 or earlier if there is a family history of cancer. Be sure to let your technician know that you have had breast reduction. You should also continue monthly breast self-examinations and annual physician examinations. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with, so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your breast reduction, a surgery date will be scheduled. Prior to surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.